As we inch closer to a new year, and of course Chicago's big New Year's Eve celebration, a lot of reflecting can lead to changes or finding alternatives for a better life. With the stresses of the pandemic and inflation this year, a more balanced life might be the key to an easier 2023. Joining us now, Dr. Greg Jones, licensed in naturopathic medicine and a hometown guy, growing up on the South Side, attending Lynn Blom Math and Science Academy and the University of Illinois, Chicago, and now practicing in the Arizona area. Greg, thanks so much for joining us. Let's talk about the naturopath approach and how does it compare to traditional medicine?
Thanks, Natalie. That's a great question. I think one that needs to be answered before we go forward, because when people ask me what's naturopathic medicine, my answer is always it's medicine, right? And at the end of the day, it's a difference in how we treat. So if you are not feeling well, and you go to your traditional doctor, they may write a prescription, they may refer you to a specialist. My job as a naturopathic physician is to stimulate your body's natural ability to heal. Now, how can we do that? It could be lifestyle changes, it could be diet, it could be natural supplementation, it could be botanical medicine. It can be we have a plethora of things to do, but at the end of the day, we're trying to stimulate the body's natural ability to heal itself.
You recommend people getting a thyroid check at the beginning of the year. Why do you do that?
So, great question. So the thyroid gland is a butterfly-shaped organ that sits right in the front of the neck. Now, your thyroid gland is responsible for producing your thyroid hormones, and thyroid hormones are responsible for controlling your energy and metabolism. So I always tell people, if your thyroid is not optimized, if you have a condition called hypothyroidism, you can work out all day long, you can eat as healthy as you want, you may not see the scale change one bit. Now, when people say, well, how do I know something's going on with my thyroid? There are some telltale symptoms, right? And you go with it, you say, okay, here's the deal. If you're not losing weight, you feel cold all the time, you're losing hair, you're constipated, your skin is dry, you can't think clearly, and you have joint pain, that's a really good indication you may want to get your thyroid checked.
I love that advice because that's a simple thing I think that we can all do just with the blood test, right?
Exactly. Now, again, this is where the naturopathic approach comes in. A lot of times when you go to your PCP or primary care provider, they may only run what's called a TSH, or thyroid stimulating hormone. You want to make sure they run your TSH, your free T3, and your free T4, because that gives the full picture of how the thyroid is functioning. Running a TSH only is like checking your gas tank and saying, hey, is your car running well? So you want to be able to look at the whole picture to be able to evaluate thyroid function.
You know, a lot of people set a New Year's resolution to declutter or maybe lose weight. Those are two common ones, right? How do we do that and also live a more balanced life throughout the rest of the year?
You know, I love to tell my patients, because again, it's resolution season, right? It's, hey, beginning of the year, I want to get in shape, I want to lose 25 pounds, I want to do A, B, C, and D. I tell people to set micro goals. So what that means to me and to my patients, okay, we're going to drink this week, let's drink more water. You know, next week, hey, we're going to walk 3 miles. Next week, we're going to work out 3 or 4 times. Setting those small goals is like taking little bitty chunks out of the elephant. Because if you set this big goal, it's so easy to get discouraged, right? So taking it one step at a time and giving yourself some space, because we're not perfect, right? So some weeks you may only work out twice versus 4 times, but appreciate the wins and the small victories and set those micro goals. I think that sets you up for success through the year, not just this year, but years going forward.
And I understand you also offer telemedicine. So if people are interested in learning more about what you do and getting more advice from you, how can they reach out?
Yes, they can go to our website at Innovative Wellness. That's ENOVATIV, so it's spelled differently. I'm on Instagram under Dr. Jones, _Dr. Jones. The website's the best way, or they can give us a call at 602-614-9905.
All right, thanks so much, Dr. Jones, for all of your advice. I hope it helps you there at home.